Face of breast cancer for so many years has been that 50, 60-year-old white woman. And so if those are the images that you see in the media, that's what the general public knows. Oh, breast cancer is a middle-aged white woman's disease.
Right. Meanwhile,
yeah, we got black women dying.
Giving more women a fighting chance. That is the goal of two women who are working to spread education and awareness about breast cancer every day of the year. According to the CDC, rates of breast cancer are about the same in black women and white women. But the breast cancer mortality rate was about 41% higher for black women from 2009 to 2013. WRTV's Amber Grigley introduces us to the organization that is working to end that disproportionate impact.
I just think we have to advocate for our own selves.
An unnerving reality.
What's important is action. Just don't ignore it.
For black women in the fight to survive against the silent killer, or what is known as breast cancer.
There's nothing else out there that's really teaching breast health that is meaningful to women of color. Women of color have to teach women of color.
Nina COLEY was diagnosed with breast cancer in October 2017. At the time, she hadn't gotten a mammogram in 5 years.
In the right breast, I had HER2 positive, and in the left breast, I had triple negative. So it was quite a blow.
I never, ever thought I was going to come back with a positive for breast cancer. They did the biopsy the day before my birthday, June 7th, received a phone call that said that your lymph nodes are benign, but there is malignant cancer in your left breast.
Similar to COLEY, Elnora Daniel got her diagnosis after going 10 years without getting a mammogram.
We are so busy doing things, taking care of other people, being focused on jobs that we are committed to. We want to do well, we want to perform well, taking care of family and children and grandchildren.
And we've actually heard from women in the community say because of these different screening guidelines, some organizations say start at age 40, others say start at age 45, some say have a mammogram every year, others say every other year. So it can be very confusing.
Lisa Hayes and Nadia Miller are both 14-year cancer survivors who came together to form Pink Forever, Inc., ending disparities, creating a space for women like Daniel and COLEY to eliminate breast cancer's disproportionate impact on black women through advocacy, education, research, and empowerment.
The research that was showing that black women face disparities related to breast cancer, including having a higher mortality rate for breast cancer, as well as we are diagnosed at an earlier age and at a later stage of the disease.
For Miller, this hits home. She was diagnosed with breast cancer at the early age of 28.
for me, if there was waiting until you were 40, I'd be dead. And so I think that from a larger standpoint, that it's necessary for there to be some, what our organization is doing, ensuring that there's advocacy around the younger woman, specifically African-American women, but also adding a face to that.
That advocacy includes removing financial barriers that some women face when seeking care. Take COLEY, for example. Due to the severity of her diagnosis, she was placed on a medication that costs $10,000 a month, and she had to take it for at least a year. Well, $10,000 over 12 months comes out to $120,000. Now, that's almost double the median household income in the United States, according to the U.S. Census.
My father had prostate cancer back in the 90s, and I had an opportunity to buy cancer insurance, not knowing that I would ever have to use it, but that extra cancer insurance really came in handy.
No one, whether African-American or even a part of the majority, should have to wrestle with or even deliberate between their life and their well-being and financial cost.
Dr. Antonio Williams at IU School of Public Health says there is still a lot of work to be done to eliminate disparities in health care. He says it all boils down to access.
Unfortunately, even though we're in 2021, the 1950s and 60s weren't that long ago. All right, and so we still have a long ways to go in the fight for equality. And we've gotten equality or some sense of equality in certain areas, but healthcare seems to be one area that's been lacking.
Working for you, I'm Amber Grigley, WRTV.
The Indianapolis City County Council has proclaimed October 30th as Pink Forever Day. The organization is holding a community day with live performances, prizes, family activities, and a chance to sign up for a free mammogram. It is happening from noon until 3 at the AMP at 16 Tech. You can learn more at WRTV.com. Great report, Amber.